Thank you, and hello everybody. My name is Dr. Karen Price and I'm president of the RACGP. I'm a working clinician. I've got a PhD nearly finished, and I've been also a practice owner in my time. So hopefully those spaces all covered for a good coverage of presidential activities. The Health of the Nation report is the once a year annual report of the RACGP, asking our members where they're up to in their general practice concerns and what the presentations are occurring in the general practice community. So the sample size is this year 1,386 with a slight predominance of women, but it's generally representative of most of the communities around Australia. So we've got an interesting collection of findings. Once again, for the fifth year in a row, mental health concerns of patients have remained one of the most common presentations in general practice, but also complex care. So we're having a cohort of patients who are ageing and multi-morbid conditions because they're being managed better through the years. So we're seeing complex care, aged care and mental health predominating in general practice. What is concerning in general practice is our ability to spend the time needed with these kind of patients to manage their longitudinal health needs. We're also the coordinators of care, and we have concerns regarding the fragmentation of healthcare into ever smaller bits. So there's a lot in the Health of the Nation report, and I look forward to discussing that with you today. The COVID pandemic has put every bit of crack in our system, whichever discipline you're in, under the spotlight. So Australian GPs have been absolutely magnificent. We've delivered over, at this point, 18 million vaccines. We've consistently been the biggest mass vaccination centre in Australia, and yet little recognition we feel has been given. Most of the media has been about the mass vaccination centres and the excitement of all of that, but yet we've trudged on it again and again for our communities. And people have wanted to go to their GP, especially the most vulnerable cohorts who we're most concerned about. Tailored with that has been, as we've seen, lots of cracks and mistrust and a loss of faith in institutions of our society, which is a real shame. We're getting quite a bit of pushback from anti-vaxxers and people who are confused by the, frankly, politicisation of the pandemic. And there's been a lot of abuse directed at front desk staff, at practice nurses and at GPs themselves. And, I get a regular communication on the forums from doctors pleading with me to bring this up because it's taking a toll. It's a career that they love. They love to deliver high quality health literacy and science information. They know the benefits of vaccination, and yet they're getting abused for doing their job, which they were trained to do. And sadly, in some cases, that's been a very, an aggressive resistance amongst the community. So that's caused a toll. And some doctors have even questioned whether or not they want to continue in that way, considering that their skills, their compassion is not valued in some way. But just remembering that is a minority, but it certainly leaves a mark on the people delivering healthcare. And I'm hearing also from my daughter, who's a doctor in the hospital, this can also occur in hospital. So it's not confined to general practice, but we've certainly seen how much distress there is in the community. This is 5 years in a row GPs have presented mental health being one of the most common conditions, but GPs have always managed mental health, and it's sort of a surprise to many people because with mental health people think of, again, psychiatrists or psychologists, but GPs are trained to do this. We train to do it in medical school, we train to do it in the hospital system, we trained to do it in our fellowship exams for general practice specialty training, and we keep training to do it in our continuing professional development. And there's certainly those GPs who have advanced skills in mental health. So we do a lot of mental health, we always have, but what has changed is that we are finding it harder and harder to manage the time required for mental health presentations in general practice. And that's a real pity if we're not using the skills that we were trained to use. Combined with that, as mentioned earlier, that mental health often comes with a chronic disease component too. So 80% of those with a mental health condition also have some degree of chronic disease. So these are comorbid, complex patients who present in a consultation, which we are highly skilled at doing. But if we don't have the time to address it, then we have concerns about how we can manage these sorts of presentations in general practice. Many of these patients are not referred on, and many of them are not claimed under mental health item numbers. So the proportion actually presented in the Medicare statistics is probably an underrepresentation of the amount of care that general practitioners do in mental health care. We need time to spend with our patients. We need infrastructure so we can develop a clinic that is suitable for modern day practice, and we can bring in team-based care, so allied health people into our teams to help us manage patients, because often patients don't have access to allied health within a community. Now, using a room for an allied health practitioner is generally more of a cost to the general practice than is having a GP. It's better to have a GP in there in terms of sustainability. So unless we have the funding and the infrastructure to develop a clinic that is fit for modern day purposes, then we're really going to struggle. We are in danger of running out of GPs. There are rural and remote communities currently crying out for it. And, you know, I've had some very direct and blunt feedback from the rural community saying it's all about the funding. Well, it probably is a bit more complicated than that, but we've got a whole generation of medical students and young doctors who are now older than they used to be because of the way that the university system is structured. And they're also graduating with a significant HECS debt. So there's a whole lot of complications around making this an attractive career. Yet, GP remains the most intellectual of all of the disciplines, if I can say. I'm a bit biased, but we cover every different diagnostic category that any hospital can think of. We are the first port of call, and that longitudinal care, that early diagnostic care, that early treatment care is vital to the health of the whole health system. And I'm pretty sure most of our non-GP specialists recognise that, because we do work together collaboratively. But it's no point having GPs type patients present in hospital when we can manage them in the community if we're given the infrastructure and the funding and the resources to do so. We can take a lot of heat out of the hospital system, and that's been proved over and over again in health economics and health system reforms all around the world.